are 45 degrees. So when you have been on your facets, you're pulling them, or the articular pillars, facets, same. You're pulling it up and over, right? You're doing an up glide. So they're at a line of 45 degrees. There's another joint in the neck, our uncinate process. This is more of a 90-degree angle. This is the reason why we commonly do not herniate a disc in our neck, because we have a lot of bony stability. The line of pull for this is straight up and straight down. So the technique you just did was to the facets, to the articular pillars, which is the line of the facets. You did all your techniques at a 45-degree angle, whether it was extension or flexion. So now this is just another way of doing the facet glides, and then you're going to do a facet openers or flexion or up glides. You're going to do now an option to do down glides or extension. That's at the facets. Then you're going to do the same exact thing, except you're going to change the angle, and it just works on the joint, the uncinate processes. So all you have to do is change your angle, nothing else changes. So far, all we've done is had the MCP area all the way down to our finger. We've done techniques where they're on the articular pillars. So this is going to be the same exact thing. Actually, you can sit up so you can see this, and then I'll do it on you. Here, stand up this side. Okay, so with this is your line of your facets. They're at a nice 45-degree angle. Here you can see the uncinate processes, a saddle like that. So we're going to want to scoop them straight up towards the ceiling. So 45-degree angle, up glide. 45-degree angle, down and in, down glide. Uncinate process, we're just going to be scooping up on the right side, down on the right side, up on the left side, down on the left side. So nothing changes, just a different way of doing, once again, same thing. We're just adding one joint. So extension, you push straight down. Flexion, you did 45-degree angle. Uncinate process, we're now doing straight up and down as well. But we're not in the center now. We're just doing, it's sort of like a UPA. We're on the sides going up and down. So for the facets, the up glide, I'm gonna get my side of my fingers on the articular pillars, the line of the facets, just on one segment at a time. And then this is just gonna be resting on the neck that's not there. So all I'm gonna be doing is a relative up glide on the right, and I'm gonna track it down and in on the left, and then I'll reverse it. Then I will check my down glide on the right and my up glide on the left. If one side or the other is not moving, I can just mobilize it, oscillate, or I could do whatever other technique, because you guys just learned 20 of them. So then we go to the next segment. Up and down, 45-degree angle, just like that. It's like dancing. And that's all you do for the facets. Same exact thing for the uncinate processes, except now instead of this nice 45-degree angle, now we're just going to come up top and be a little bit more horizontal. Horizontal. And now we're just going to do the same thing, except we're going to swoop up towards the ceiling, down towards the floor, up towards the ceiling, down towards the floor, and you're just going up and down to check out those. So look on each other and see, does one side move versus the other at different segments? And then is one maybe fine on the facet, but stiff on the uncinate region? So all it is, supine, up and in, down and out, up and in, down and out. Now change your angle, up and in, or not up, down, up, down.
Same spot, sorry.
Same spot, articular pillars. That's why articular pillars are so important. Now jump up on your back.
Look at that.
So all it is, find the articular pillar, great. Get under the skin, we're there. And now all it is I'm taking that and I am pushing up and out. So right side up glide, and then down glide on the left. And switch.
That's for 45.
This is your 45. Now those feel fine. Move to the next segment. Up, down, up, down. Now we're going to go to the uncinate, same concept, you're in the same area. Got the sides of my fingers on each. up, down, up, down.
You're just feeling for like the pillars to kind of like firm up at the appropriate.
Yeah, there should be a symmetrical rotation that occurs.
Got it.
Questions on those? You guys are definitely gonna feel, some of you are gonna be stiff, some of you will not be. Okay, 5 minutes and then we'll